In the clinic, obviously, I would do more targeted releases, but for the sake of this video, I'm going to work in a progression from feet to head on the patient so that people who are doing more general work can also incorporate this while they're learning to do more precise work. So the first thing, working on the foot, I'm going to grab a hold of the metatarsals, and I'm actually going to shake the calf to loosen up any fascia. This also mobilizes the joints, the tibia and fibula at the knee. The first thing we're going to do now is to use the T-bar tool, and we'll use the flat edge, and I'm going to work the fascia along the bottom of the foot. Of course, the fascia starts here on the calcaneus and runs this direction. So first we're just doing the most superficial layer. There are several layers going deeper and deeper in. So we've warmed up the fascia. Now when we go over here along this side, you can see in the picture-in-picture there's a muscle that runs right along there. She's very tender right in that spot. So in an actual therapeutic setting, I would press in and hold and work that through. Now we're going to leave that foot for a couple minutes to let blood infuse and some of those trigger points to deactivate. So I'll set my tool down and get a hold of the, actually in an actual clinic setting, I'd grab the corner of my sheet and grab a hold, and I'm going to stabilize the foot and just work those joints. You've done all of the toes. You're going to go back and work the bottom of the foot deeper, get those deep muscles, and then I'm going to take the edge of this tool now and go right over here, and I can work all of these areas. You can use this on the side of the foot as well. You can use this all over this calcaneus, all over this talus. I would also get in here, and depending on how tender they are, this is fairly healthy. I would probably switch over Precious tool, and it will get in a little more aggressively. You can see it has a little sharper edge there. And now I'm going to go around, catch even these tendons around the malleolus. If there were areas in the bottom of the foot that were very, very tight, I would also use that edge to go in and work those. And then we're ready to move up into the leg. Okay, so the next thing we're going to do is some traction in this knee. I'll put the knee between the ankle between my knees, and then get a hold of the knee and just push lateral back and forth. And then we're going to start working on that soleus and gastrocs with the best friend tool. So I'll put a little lotion on it and on her calf, and I have the luxury of bringing the table up a little bit higher, and I will adjust the tool to the proper height for me. So we're going to work through the gastrocs here using the best friend tool. I can put this area on the outside of the gastrocs and work the more lateral one more specifically, or of course I can come over and work the medial one more specifically. Depending on how healthy their muscles are, I would probably use the round area on the Precious tool, and that will allow me to get deep right in between those heads and treat all of that. Also treating a little bit of the soleus here as well. She's a little tender there. Now, of course, we need to treat everything from the bone over this direction. We're going to pull the gastrocs over, and again, we can slide up inside here with this tool. Okay, we're going to work up into the thigh now, but the first thing I'm going to do, if this person's pelvis was in flexion, these gluteal muscles are actually rather fatigued or weak. So first of all, I'm going to hold her hip down and have her lift her leg up a little bit. You can see she can't lift it very far. So the first thing we'll do is bring her knee out. Basically, I'm bringing the foot over to the opposite knee. And I'm just going to do some compressions. Let's just test just for, even though I haven't done it very long, just try lifting that leg again. And we've got a little bit more there already. So now we're going to go right into those hamstrings. So I'll add a little bit of lotion. And the first thing I would do is grab the best friend tool with the effleurage tip. And again, depending on my angle, I'll move my hand so you can see the tool. It's going to cover a great deal of area here. And by leaning the tool this way, this is going to be activated more. By leaning this way, I could get into the opposite side. In a natural setting, I could even go to the other side of the table and work through to do that. But I've got both of my hands on the person, and I'm working through this more lateral hamstrings here. Okay, we've drawn on the sacrum here and the iliolumbar ligaments, and of course there are ligaments right on the sacrum, no muscles, and we need to treat those. They stabilize the SI joint, they stabilize the whole area. So we're going to treat in this sort of a pattern. Now for the sake of the camera, I'm going to go to the other side, and initially you can use this tool, and we'll go right in and treat those areas. Depending on how tight the person is, I will usually go right to the precious tool. So now I'm going to go out a ½ inch and treat. I'm going to switch over because this tool is actually much more effective. And as you work your way down, you'll feel like right there's a tender spot probably, or a tight spot at the very least. And about an inch over from the PSIS, you'll find that iliolumbar ligament. I'm going to put a little lotion here. It's probably going to smudge everything. And I'm going to go right in. So the spinous processes are here. When you're working the piriformis, or actually any of these muscles, you can do some nice movements here as well to change the angle of the piriformis. Also, a really good idea is to get a hold of this fascia and drag it this way, and then push the leg the other way and drag the leg towards you. But basically you're trying to bring the fascia one way, hang on to it, and bring the leg back to give a nice stretch to it.